Hello to those of you who've already joined us. We're just waiting for a few more people to be admitted into this webinar. So, hello and welcome to this TCPA APSE webinar, launching a short report called Restricting the Appeal and Availability of Junk Food in England, the Role of Councils. I'm Julia Thrift, the Director of Healthier Placemaking at the TCPA. Before we get going, I'd just like to let you know that this webinar will be recorded and the recording will be available on the TCPA website along with the report we're launching today. If you have any questions for our speakers, please post them in the Q&A box and I hope we'll have time to take them at the end. Over the years, the TCPA and APSE have collaborated on a number of projects and we're delighted to continue this partnership. So I'm very pleased to welcome Mo Baines, the Chief Executive of APSE, to say a few words. Over to you, Mo.
Thank you ever so much, Julia, and it's wonderful to be here once again with the TCPA. As Julia said, we've worked very closely with the TCPA over the last, I would say, longer than a decade, actually, Julia. We've done around, I think this is our 10th report with the TCPA, having done a lot of joint reports in terms of planning issues. I think the starting point for this particular paper that we're launching today with the TCPA stems from our National Council. So APSE's National Council set our research policy and programme for the year. And last year, they expressed frustration at planning regulations. They also expressed frustration on the impact of public health of the proliferation of takeaways, particularly in the areas of poorest health and, of course, poorest wealth. The impact of promoting poor food choices for children and young people in particular, and ultimately the issue of councils picking up that bill. And by that, we mean not just the impact on health that ultimately comes to councils by way of support, particularly including children's services, issues such as dental health that's increasingly difficult for local authorities to look at, to comply with, particularly in areas like looked after children. But generally speaking, the general mess that's made from takeaways as well. They have a street team role and they're forever cleaning up after these often not just poor health choices, but poor choices in terms of the local environment as well. So councils are very much having to deal with conflicted policy areas. They feel that the shunt of the cost of these types of takeaways and the proliferation of them on our town centres and high streets is often placed back on the public person, back on councils themselves. Councils certainly are not saying they don't want to see growth and vibrant high streets and vibrant town centres, but it's the impact of the types of premises that we're seeing opening up that are really having this unhealthy impact on local communities. I'm really pleased with the TCPA report. It sets out a number of practical actions that our member councils can consider. It's particularly useful, I feel, for elected members, for local councillors, to actually challenge where officers are when we're often told there's nothing that can be done, this is going to happen, there's nothing more we can do about it. And actually it also challenges central government in terms of looking at some of the issues around advertising regulations, for example, and how we could perhaps better use planning regulations to support better health in our local communities. So before I hand back to Julia, I would just like to say a big thank you to TCPA, Julia and the team, for all their work on this particular issue. I'd like to also thank APSE's National Council for their support in bringing this research paper to fruition, and a huge thanks to APSE's Vicky Hacking. Vicky has obviously coordinated the research on behalf of APSE, and I think what we have today and the paper that will be available later today on the APSE website is a really great little piece of research that people can use in a very, very practical way. And I'm sure that all of us who are battling with this issue of public health and that conflict of ensuring ensuring that we have vibrant growth in our local economies, but not at the expense of the health of our communities, will really welcome, like I do, this piece of research today. So I will stop there and I will hand back to you, Julia. Thank you.
Thank you very much, Mo, and we're very pleased to have been able to collaborate with you on this report. It is a fairly short report, and I'm going to give a very brief introduction to it, but there's a link there on the screen. It's available on the TCPA website and on the APSE website, so do take a look at it. In the limited time I've got, I'm going to concentrate on the recommendations. So in terms of thinking about the food environment, the availability of good or less good food, where people live, where people work, there are lots of different things that councils can do to help shape food environments, to create healthier food environments. This report just focuses on two different things. One is about restricting the proliferation of hot food takeaways, and the other is about what councils can do to restrict outdoor advertising, particularly for unhealthy food. In terms of advertising, there's actually very little that councils can do to refuse planning applications for new outdoor billboards. But what they can do is use things like sponsorship policies to restrict what gets advertised on the billboards they own. And we'll hear a bit more about that later. Focusing on the recommendations, perhaps we could move on to the next slide. So why does this matter? Throughout the country, obesity and overweight are a real blight on people's lives. They lead to all sorts of different illnesses and difficulties for people, and they cost the NHS and the wider economy an enormous amount, calculated to be around £98 billion a year. So this is a personal problem, and it's a problem for society as well. And it's also clear from the research that hot food takeaways and advertising for junk food are really concentrated in poorer areas where people already have poor health. And where unhealthy food is very easily available and really heavily advertised, it's much, much harder for people to make healthier choices. So relying on people to do the right thing it's really unfair when the environments in which people live are pushing them towards unhealthy food. Next slide. So I'm going to cut to the chase and go straight to our recommendations. So firstly, we think that the balance of power, if you like, is unhelpful at the moment. Councils can use the National Planning Policy Framework, the NPPF, planning policies to restrict the increase in the number of hot food takeaways or outdoor advertising sites in their areas. But they have to go to do an enormous amount of research, and public health teams have to do a huge amount to prove that an additional hot food takeaway will have a negative effect on a particular community. And we think that given the national crisis in poor health, the council should be able to apply the precautionary principle and say, actually, in this particular area, given the health problems, we should just be able to, it should be far easier to refuse an extra hot food takeaway. So we think the precautionary principle should be something that councils can use rather than having to go to an enormous amount of research to restrict just one more hot food takeaway. Next slide, please. So the government is aware of the problem of junk food and poor quality food, particularly on children's health. And when the government updated the National Planning Policy Framework in December last year, they introduced the phrase fast food outlets and suggested that councils in some circumstances might restrict the proliferation of fast food outlets. But unfortunately, they haven't provided a definition of what fast food outlets actually means in planning terms. and this makes it very difficult for councils to know what to do. So hot food takeaways are very clearly defined in planning policy, but fast food outlets aren't. And this has led to quite a lot of puzzlement within councils about what they can actually do to restrict fast food outlets. So we think it would be really helpful if the government could provide a planning definition of fast food outlets, so that to empower councils to address this problem. Next slide, please. And finally, in terms of advertising, councils can introduce policies to restrict the type of adverts that are shown on the billboards that they own, but there's very little they can do to refuse planning applications for new advertising sites, particularly billboards. There are regulations that say that planning applications for new billboards can be turned down on the grounds of public safety and amenity. But public safety is very narrowly defined in terms of people might crash into the billboard or something like that. And we think that definition should be included, should be expanded to include public health reasons as well. So if there's an area that's already very saturated with large external billboards, council should be able to say on public health grounds that there should be no more in that area. Another reason that councils can currently refuse a planning permission for a new outdoor billboard is amenity. But the definition of that is very much about protecting historic and beautiful places from ugly adverts. So places that aren't conventionally attractive are less able to restrict the amount of new external advertising they have. And again, we think that that needs to be updated, because the research shows that it's actually poorer areas that might not look quite so attractive that are already saturated in advertising. So we'd very much like the government to take a fresh look at the regulations. Next slide, please. So in conclusion, and this is a very brief overview of the report, so do have a look at it. The evidence shows that poorer communities already suffer the worst health, yet they live in the places with the highest concentration of hot food takeaways and adverts for unhealthy food. This is really unfair, and it's contributing to huge costs to the NHS and the wider economy. And although councils are working really hard to create healthier places, and the planning system has a role to play, councils could do far more if planning policy and regulations were updated. So I hope that you enjoy looking at the report and find it useful. I'm now very pleased that we can feature speakers from two of the case studies that are included in the report. And I'd like to hand over to our next speaker, please, who is Bev Bayliss from East Sussex County Council. Over to you, Bev.
Thank you, Julia, and I hope you can all hear me okay. Please say if you can't. So I'm here today to talk to you about the development of our hot food takeaway guidance at East Sussex County Council. And just as a bit of background, I've been in this role for over 3 years now. I've come to public health from a district council. My background is a town planner. And I just wanted to really reflect on what it's done to get to the point of no guidance to guidance. And it's a really a topic with a lot of it's a lot of high profile at the moment. And I hope you'll find this interesting. And I appreciate I have an awful lot of text in my slides, but I'm not going to run through every single item, but I will pick out the key elements as you'll be receiving the slide deck afterwards. Next slide, thank you. This afternoon, I'm going to cover a bit about our team overview, a bit about the context of East Sussex and where it sits in the country, and how we are developing partnership working across the county, and then finally what's led to us taking on board this guidance, and finally a bit about the evidence and data contained within the guidance, and some examples of draft hot food takeaway policies that are now coming through in emerging plans. Next slide, thank you. So we're in a team of 4 specialists. We work in a wider Healthy Communities and Places team within public health. We sit in adult social care. We take many different approaches to our work, but our Our basis is creating healthy and sustainable places. Including this, we champion and support the use of health impact assessments. And within this, as an aside, we've been looking at takeaways specifically. It's really important to note that we're not a statutory consultee in planning matters, which we very much like to be, but we do respond to local plans and other consultations too. Next slide, thank you. East Sussex is located on the south coast. We have a population of approximately 550,000 people across 6 local planning authorities. That includes the South Downs National Park. We have both rural and urban areas and some coastal communities. And this with it brings its own challenges, with East Sussex being the 5th most deprived of 26 county councils, with concentrations of deprivation being in those coastal areas in our authority. Next slide. So in order to facilitate working across our local authorities, we developed the East Sussex Memorandum of Understanding between public health and our districts and boroughs and our own county planners. So this demonstrates how we work across the system. Everybody signed up in 2022, and it shows how we're going to work to fulfil our duty to cooperate, and how we're going to produce high-level actions between public health and local planning authorities to produce healthier places. We followed this up with individual working agreements between the districts and boroughs that show the specific working processes and roles and responsibilities, as our districts and boroughs are very varied in their geography and their demographics. And to implement this working together across a 2-tier authority, we introduced the Planning for Health Working Group. We meet quarterly and we work towards co-developing county-wide guidance, frameworks and templates to deliver on planning for health. And that includes this guidance document. Next slide, thank you. So in this section, I'm going to explain how we've worked together and what we've done to undertake this guidance. Next slide. So I think what's really important is primarily that there was a gap in this type of guidance. And we believe we needed something to address the healthy weight environment, as well as supporting our healthy weight plan that Public Health produced. There was nothing else that was in this kind of detail that we could find, and it really didn't have anything what we could find that suited our demographics and our issues. We did currently have we actually have one current hot food takeaway restrictive policy in the bottom green, one of the boxes here. In Rother District Council, they have a specific town-based policy restricting takeaways, but it's not for the whole of Rother. So I'll come to that one later, but it's just a very specific policy, which I don't really know if that's being activated. And what with the rise in obesity, really thought there was a massive gap that we needed to fill for our county. Next slide. So the purpose of the guidance, we really wanted to show public health and the background to the obesity crisis, and explain the elements of specifically around hot food takeaway justifications and approaches for restrictive local plan policies. That is the crux of the guidance. We've identified different tools and mechanisms for developing hot food takeaway approaches, and looked at the evidence base to support that. So we've wanted to build the case and the argument to do no harm, and again, as Julie mentioned, that precautionary principle. And primarily to provide public health guidance to decision makers around hot food takeaways. Next slide. So as we developed the guidance, we were really conscious of how it could potentially be used and what it could influence. And key to this guidance is, as I've mentioned, it's providing evidence to our local planning authorities to justify including restrictive takeaway policies within their local plans. We've been upfront as well about how we will assess planning applications based on obesity and deprivation, for example. And we hope that it will encourage developers and applicants to consider healthier food options as an alternative to traditional hot food takeaways. And we wanted to future-proof the health of our East Sussex population by replicating those national efforts to tackle obesity and health inequalities at a local level. So the next slide, please. So I'll just explain the process that we went through, and I'll talk about how we got support from our senior team to endorse the guidance and some of the challenges that we considered as we built the case. Next slide, thank you. So we communicated to our public health colleagues what we can do with the guidance. We were very clear about it setting a wider contribution to tackling obesity and healthy weight and creating those healthy weight environments. And as a starting point to build on our work with our other public health colleagues in developing their healthy weight plan. We wanted to have the guidance structured in a standard format that could be used within the planning system with that language that works for both planning and public health. So it's a practical and a user-friendly document. And wanted to make sure that it set out clearly what our principles and our context and our approaches were. Next slide, thank you. Again, it was really important to communicate to our senior team what the guidance didn't do to manage expectations to both planning, public health and our planning colleagues. We wanted to make it clear it was only for hot food takeaways. We were very clear it's for the sui generis development type, and it wasn't for our KFCs and our McDonald's, because that's a whole other world, a whole other area of development that we just didn't have the scope to tackle. We wanted it to make it important that it doesn't solve the issue of current hot food takeaways, but we were trying to future-proof future ones. And very importantly, is that it can't solve all the issues. It can only play one part in the system. Next slide, thank you. And within the guidance that we produced, I just want to explain some of the chapters and what it contains, and there is a link at the end of this document that you can have a look at the guidance. But what we did do was include sections on the relationships between deprivation and fast food exposure, and include our own data intelligence on obesity rates in East Sussex. We also wanted to link together the deprivation and obesity in children, and also give an overview of the links between inequalities and the prevalence of takeaways. And then neatly summarise that with a set of maps and some examples on other approaches to restrictive policies. Next slide. A set of maps was produced by our Public Health Intelligence and Research team. They have taken the data from the same source as the Food Environment Assessment Tool, which looks at locations of takeaways, and they've replicated the methodology to link in with our own data and other national data sets. And the map you have in front of you shows the location of hot food takeaways in red, mapped against ward level data showing where the takeaway rates per 1,000 population is higher or lower than the national average. And in this map, you can see the darker areas are where there is a higher rate than national, and those aligned to the more deprived areas on our coastal communities, with some other focused areas within our more rural towns. Next slide, please. So alongside planning policies, we were also very aware there are other measures available to help regulate the provision and access to fast food, and many of these within the licensing and the environmental health regimes. Although we couldn't touch on all these areas in the guidance, we just wanted to nod that they're also here, and it is a really important part of knowing that it's as a system, tackling these together is one of the solutions that we can do. So as we delve into this area of work, we have realised it's more than just the policies, but these other elements. Next slide. And one thing we've been really pleased to see is this stricter hot food takeaway planning policy now in the National Planning Policy Framework. We are really pleased to see that the government has taken the issue of obesity seriously, and that local planning authorities can now start to use this criteria to assess planning applications. Next slide. So as I mentioned at the start, I wanted to include a couple of examples of emerging local plans within the county that are now including restrictive hot food takeaway policies. The example you have in front of you is Rother District Council. Their Regulation 18 local plan has a new reducing harmful impacts on health policy. And this includes criteria that seeks to restrict proliferation of hot food takeaways as well as other uses such as payday loan shops. And it's looking at to restrict within 400 metres of a boundary of a school or park, and looking at controlling by opening times as well. So we're really pleased to see this new policy, although it hasn't been tested at examination yet, but we're hoping it will go through successfully. So moving on to the next slide, thank you. And my last example is another local plan in Lewis District Council. This is from their emerging Regulation 18 plan again. And this is a healthy local food policy. This takes a more holistic approach to food within the district. It's an excellent policy. It looks at a whole range of different options within the food system, and they're looking to support healthier food and increase healthy food consumption, again protecting the obesity and the healthy weight within their authority. Criteria 7 in this policy looks to restrict hot food takeaways through looking at concentration and looking at the number of takeaways within a ward, and they're proposing to use the food environment assessment tool to base this assessment on. So on to my final slide, please. So just general reflections, and we have reflected that there is no guidance nationally, so this is why we have undertaken our own bespoke East Sussex guidance. We've looked to collaborate with our Planning for Health working group, and that addresses the two-tier approach. We wanted to lead without authority in an area where we can influence, where we can't make those decisions, but we can do what we can within our remit in public health, and taking on board that precautionary principle to protect the health of our county. And finally, I just wanted to note at the bottom of this slide, there is a link to our public health hot food takeaway guidance that I hope you will read and find interesting, and any feedback will be very useful. And I'm going to hand now back to you, Julia. Thank you.
Thank you very much, Beverly. That was really comprehensive. And I think one of the things that I find really interesting about your guidance is that as a county council, you are working with a number of districts who are independent councils who can do what their elected members want. And you've been working with them in a very collaborative way to bring forward your guidance and help councils apply it in their areas and think about how it might apply to their very different places. And I think that's interesting in the context of the proposed changes to local authorities, and that influencing role is going to be so important if we have strategic authorities with, as is proposed, a health in all policies remit. So we'll have to see how that plays out, but really interesting to see what you've been doing. Thank you very much. So one of the other case studies featured in our guidance is around using advertising and sponsorship policies to restrict what's advertised on the council's own site. So I'm very pleased now to welcome Tim Borrett. Tim is Director of Policy Strategy and Digital at Council, and Tim's going to give an overview of the work they've been doing, which is also featured in the report. So thank you very much, Tim, and over to you.
Thanks, Julia, and good afternoon, everybody. I realise looking at this slide, I've been less organised than Bev, so if anybody wants to email me, it's firstname.lastname tim.borrett@bristol.gov.uk for anyone who wants to follow up after this. So yes, I'm going to talk you through our journey creating and approving advertising and sponsorship policy in Bristol. This was actually back in 2021. And I think we were the first city outside London to put HFSS restrictions into this type of policy. So we thought it'd be useful to go through that journey and give you some of our learnings. So if we pop onto the next slide. So there's a little bit of context. Like many cities, Bristol has a lot of ingrained health inequalities and clear linkages through to issues like obesity as drivers of poor health. If you live 1 mile in a different direction of the hospital in central Bristol, your healthy life expectancy difference would be over a decade. So some really stark disparities between people's outcomes in the city. Because of this, health inequality is a really central part of our policy framework. So we adopted a health in all policies approach. I'm not a public health person myself, but working in the central policy team in the council, we always factor health into everything we do. And that was a key reason for developing this policy the way that we did. We were very fortunate coming into that journey in that we had a lot of support already. There were some quite vocal public groups who were in general against advertising, but particularly of unhealthy commodities. Our councillors were very supportive already, and we were coming off a really good precedent set by Transport for London, who were incredibly generous, sharing their experiences and their content with us, which made that process a lot easier. The issue that's been raised already is around the control we have of sites across the city. So our policy, of course, only impacts Bristol's own sites, and that's a relatively small amount of the advertising real estate. It's less than 30% of the advertising real estate in Bristol. So we were seeing this very much as trying to set a good example and role model good practice. But we do recognise, and we did recognise, it would not reach everybody. We also had revenue coming in from our sites of around £1 million and were prepared to accept a financial risk. And in our papers, when we took this to Cabinet, we quantified that potential loss of income within our risk register, so that councillors were able to sign up to this with eyes open. In reality, that's not been the case. Our revenue's actually gone up since adopting this policy. We've not seen any impact. So if I go on to the next slide and talk you through a little bit of the journey. This says there's an 18-month period developing this policy. I will say with caveats, because in March 2021, the preceding 18 months, we'd had some other things on our minds, and I won't mention the pandemic again. So fair to say it was an 18-month period, but it was not 18 months of concerted policy development or a difficult journey. It was something that we kept coming back to when we could find breaks in play. We also wanted to make sure we did some really good quality stakeholder engagement and work closely with our councillors and people who would be affected by the policy to make sure that we had something quite practical when launch time came. And we indeed took it through formal scrutiny meetings in the council to test it along the way. So following that session with the scrutiny, we broadened out some of our restrictions on high-fat, salt and sugar food, which I'll talk about in a little while. We clarified some of the decision-making process, and that was particularly giving ourselves some clauses for pragmatism. And again, I'll come on to that in a little bit. And we also picked up some consideration of the council's environmental aims. There was discussion of trying to broaden this policy out into, say, high carbon advertising, but it wasn't quite the right time to do that. We didn't have the same precedents to go on, and we decided in the circumstances to move ahead as we were and to come back to that later. So that eventually led to a full adoption of the policy in early 2021. On to the next slide, please. So main tenets of the policy, it was to set a consistent council-wide approach to advertising and sponsorship, and both what's allowed and restrictions. So it's not just a restrictive policy, but we did need a consistent council-wide approach. We had lots of different services doing things in very different ways around the whole council. And one of the things to say on the topic of junk food is this absolutely applies to sponsorship as well as advertising. So it also affects the sponsorship deals we'll take. It sets out a very clear list of what we won't allow, and we've put that on the next slide. We do say not exhaustive, and that was one of those bits of small print that's quite helpful. So we reserve a right to refuse anything that we see fit, because it's our site. And that does mean if you do find someone with a loophole, we do have the tool at our disposal in the policy to still take action. We also made sure in this policy that if we were signing up to sponsorship deals in particular, that we were doing that with a signed agreement, that all sides were clear on the expectations. And again, that's a bit of good governance that just wasn't in place more broadly around the council at the time. We have tried to be pragmatic throughout, and you'll hear that word from me quite a few times, I expect. And we did say that this is a policy that doesn't need to be applied retroactively. So we had a lot of commercial contracts in place. We didn't think it was always going to be practical to revisit those while they were live. So this was very much something that we saw rolling out in practice over time. And as contractual review dates came up, then we would build the appropriate clauses into those contracts. We've covered some of the way today the role of us as a planning authority. So really this policy just clarifies that and notes the level of restrictions we have in that area. That was important to us in terms of managing expectations and what people wanted us to be able to do versus what we could do. We also produced a guidance note, you'll see pictured on the right-hand side here. Very happy to share both the policy and this guidance note with anybody who wants it. This was borrowed liberally from Transport for London with their permission, and does set out a lot of really useful practical small print for people who've actually got to use the policy in practice, because it turns out that there's quite a lot of detail to doing so. If we move on to the next slide. So this is the list of not permitted. I won't go through the whole list. But just to enlighten a couple of points of detail around HFSS, you'll see here it's promotion or availability of foods and drinks. That does not just mean junk food adverts, so that means where it features. And that's an important point in the policy. So if you are a commercial bank and your chosen artwork is children eating lots of ice cream in happiness at your bank accounts, we won't accept that, sorry. It may be that you're a bank, not a fast food outlet, but it's the food and drink that matter, not the brand. It's also a healthy product substitute policy. So what we mean by that, and you'll see this on the right-hand side, we won't accept brand-only adverts. So this is very much about substituting healthy products for unhealthy ones. So if you're McDonald's, you won't be able to advertise a Big Mac. We wouldn't accept the Golden Arches by themselves as a branding-only advert, but we would accept an advert from McDonald's where you're promoting a compliant food that's not an HFSS. So it does mean that no brands are banned from advertising. It's just about encouraging the right kind of promotion in our eyes from those brands. Following Transport for London rolling out this policy, also worth saying, most of these brands know full well and are very practical about it. They just have the alternate artwork lined up. So many of them haven't stopped advertising. They just provide the compliant artwork. So it is something which, again, in practice, we haven't seen some of the barriers we thought we might, or some of the drop off in income that we thought we might from doing it. Also worth picking up briefly on the alcoholic drinks, and that's another area where there's been levels of pushback. So I know it's not the main focus of today, but it is just worth bearing that one in mind. For example, anti-drink spiking campaigns have come up since then, and how to do that without picturing alcoholic drinks, question mark. So across the piece there, we've picked up some practical learnings from implementing the policy. If we move on, I'll talk through some of those now. So pragmatism's back again. Very early lessons learned about the letter and spirit of the policy. Those looking at the previous slide closely will notice it said without exception. That's not always entirely true. The reason the policy says that is because if you allow the exceptions by policy, you need a whole process set up and people will come and apply time and again to be accepted. So we really do that behind the scenes. If we've got artwork that we think may be something we can live with, we'll quietly let that go. So, for example, the salt content of smoked salmon's come up before. We were less worried about that being advertised to school children than chocolate bars. So you do need a dollop of pragmatism. Pictured on this page is one of our early lessons. We won a Gold Sustainable Food Award in the city, and we chose this image to go with it, which was a pie locally baked, and went on to become known as Piegate in the press office in Bristol, where we had quite long debates around whether we should or shouldn't be using that as our promotional image. We did eventually allow it. We didn't want to be complete sticklers, but it does just go to show people go into these policies with an image in their mind of what they think they are restricting, and then the practice of that can be all sorts of things that come up over time. Anyone going on this journey, I think, could expect a strong level of interest from councillors, campaigners and the public. We certainly found that. We did find in practice those calls were for us to restrict more than we had. So in reality, the main calls we had was for us to be more restrictive. But it did just drive home that with the value of doing this in public and having that early scrutiny. It does take time on the nuances though to get this just right. Next slide. So we've undertaken an evaluation of this, which I won't go through in detail. It would be a whole other webinar, but we partnered with the University of Bristol and some of the local health trusts in a piece of research that was funded by the National Institute for Health and Care Research very kindly. What that broadly came back with, it says unhealthy commodity advertising in Bristol has decreased after the new policy was adopted. So it fell from 12% of the advertising in the city to 0.8%. Comparing that to someone over the border who doesn't have that policy, theirs rose from 0.9% to 20%. So the exposure to unhealthy commodities and adverts definitely was impacted. What we unfortunately didn't see was the level of self-reported behaviour change. There's various factors around that discussed in the evaluation reports, but perhaps unsurprisingly, given the relatively small amount of advertising space we control, that hasn't necessarily manifested in people actually making healthier choices. So we really do see this as a role modelling piece and about displaying our values and encouraging others more than necessarily thinking it truly changes everybody's choices day to day. There have been a few breaches, and I think the systematising of enforcement has been an area that we have faced challenges with. We are fortunate that things like our bus stops are all run by external parties. So when we let the contract, we essentially put all of the onus in managing this onto that contractor. And all we have to do is keep an eye on the sites. So we do that fairly ad hoc. We do that with members of the team who are interested. And if anyone sees a rogue bus stop on the way to work, we know who to drop an email to. So again, it's that pragmatism versus getting the perfect. But it is something that we continue to want to do a little bit better on, and we'll be certainly keeping in mind for the future how we systematise that better. We are due to review the policy, and we'll be coming back to some environmental restrictions and probably some learning about advertising in areas like parks, wayfinding within food festivals, places where it might be unavoidable to have a complete ban on unhealthy food being advertised, and you're within a controlled area where people know what they're there for. So again, we'll be revisiting that with some of our colleagues just to make sure that everything feels proportionate. And as a final point here, we do have our own in-house design team, so that's made it much easier for us to actually enforce compliance with our own artwork. Anyone coming into this without that kind of centralised view of their comms and marketing might want to think about how they achieve that in their authority. I think that's probably it for me. I think there might be one final slide on our next steps, so if we move on to those. We are now looking at a broader approach to prevention in our corporate strategy, and we'll be putting that lens onto the future policy review for this. And that will include, as I said, high carbon, and thinking about some of the health impacts of that as well. We've also got the Why Wait pledge that we've produced alongside health partners signed up to there, and that commits us to take further action on tackling weight inequality. So really interested to hear the previous speaker, and ideas like that will absolutely be the sorts of things we'll look at there. So I think that's it from me, but very happy to take any questions in the next section.
Great, thank you very much, Tim. That was really interesting and lots of practical advice there as well. And I'd really like to thank Tim and Bristol City Council, and also Bev from East Sussex County Council, and the other case studies that we weren't able to feature at the webinar, which are Sheffield City Council's advertising and sponsorship policy, and also Gateshead Council's hot food takeaway policy. So do have a look at the report and have a look at the case studies in there. And I'd also like to thank the many people who contributed their views and thoughts and expertise to the research we did for the report. We're getting questions in the question and answer box and also in the chat, so I'm trying to juggle both. One of them that's come up, which I think is the obvious one really, is were either of you did you face pushback from anyone, perhaps elected members, that what you're doing is, nanny state-ish, and that really people should be allowed to make their own decisions about what they eat, and the council shouldn't be getting involved in things like restricting advertising or hot food takeaways? Bev, I wonder if I could put that question to you first.
Thank you. Yeah, and that's a really interesting question, as that has not come up so far in the development of our guidance. I think it's really important to note that what we're aiming to do is to get restrictive or healthy food policies within local plans, and that is the aim of our guidance. But what I would note is that those policies, once they're in those districts and boroughs around our county, those policies are ultimately approved by the elected members and the councillors. So I'm assuming there has been no pushback, because those two case studies I put in for our county as an example they're in those local plans, so there's clearly support for a healthier weight and restricting takeaways. So far there's been no pushback, and I just hope that those policies and others which are emerging will go through. Hope that answers it.
Thank you. Tim, how about in Bristol? Did you face any accusations of being the nanny state?
Same experience, really. Very, very little pushback. I think probably that phrase maybe came up maybe once from one or two members, but in general, the push was please go further. As I mentioned, we've got some quite active campaign groups in the city who are really against advertising in general. So it was that voice that was loudest in that debate, and absolutely no public forum received on the nanny state subject. So a little bit surprised that was the experience, in all honesty, but absolutely flew through the process.
Great, thank you. One of the things that we found through doing this research is that poor quality food is available in so many different places. Petrol stations, train stations, newsagents, ice cream vans, burger vans. And similarly, advertising for poor quality food is everywhere. It's not just on the big billboards, it's also on telephone kiosks and on bus tickets, and in some places you're just bombarded with different forms of advertising. One of the struggles seems to be for councils that each one of these different media, whether it's a phone box or a big outdoor advertising hoarding, has completely different rules and regulations, and tackling all of those different things is immensely time consuming. And I think, Bev, what you've done in your report is really helpful in that it brings together so much evidence and expertise into one place. That's very empowering, and I'm sure lots of other councils will find that useful. But I wonder if you can comment on the difficulties that councils face in trying to tackle all these different aspects of poor quality food environments.
You're right, it is really, really difficult to consider. And I think I've got a slide in my presentation which talks about, yeah, we realise that policy making isn't the only thing to do. There are other approaches such as the advertising and other mechanisms that we could potentially do. But it is so complex, but trying to bring all these different approaches together at the moment, it just seems impossible. That's why we've had to focus solely on one and try just the hot food takeaways and try and do that as well as we can. Like you said, it's time consuming, it's expensive for local authorities as well, to try and tackle the KFCs and the McDonald's. They come under a different development category, which and the drive-throughs, that's on a completely different category. So they're already fighting that. But it's disheartening when you can, like what you've just mentioned, there's so much out there. And it seems to be that policy and anything we're trying to do can't keep up. We have the dark kitchens, the food apps. We cannot keep up quick enough. But there is at least recognition that there is data and evidence on poor health out there that we can effectively use. So it's really important to harness that. And I think, well, I'm hoping that planning inspectors, specifically for planning, are starting to realise that. So that's I hope that it just adds. It just confirms that the point that you're making is very complex.
Yes, and we heard that from lots of public health teams, that just tackling one of those problems requires such an understanding of rules and regulations and the law, and it's a drop in the ocean because there are multiple different ways in which poor quality food can be promoted and is being promoted throughout the environment. We've got a question about baby foods and baby formula, and I wonder, Tim, is restricting the advertising of baby foods and baby formula something you've considered in your policy?
So the honest answer to that question at the time of developing that policy was no, we didn't, but it absolutely has come up since. So that's one of the areas that we are going to be looking at in the policy review that's coming up. I think we're probably minded to put that restriction in as a recommendation from officers, but that will obviously be subject to political discussion when we get into that review process.
Yeah. Mo, I don't know whether you'd like to contribute anything. You're on the screen. You're very welcome to say something if you'd like to at this point, but if not.
Yeah, thank you, Julia. Going back to the point really about the role of the local authority in terms of interventions, and are we accused of being the nanny state? My kind of response to that, Julia, is, that could have been an accusation when we had the Clunk Click campaign with the seatbelts. It could have also been the accusation when we restricted the sale of tobacco products to, in terms of the age restrictions there, and what we've seen now in terms of the ban on disposable vapes and the impact to the environment. It sometimes takes very bold policy decisions, and rather than being the nanny state, I'd much prefer local authorities were accused of being the gangster granny and actually going out and getting things done, because too often this is a David and Goliath battle. As we've referenced KFC, McDonald's, those huge companies with big firms of lawyers that have lots of time to go through and really pull apart the planning regulations in order to get their developments through. And at the end of the day, we have people that are suffering from cardiovascular disease, from diabetes, the impact of obesity on people being able to retain work and skills and stay in employment because of the impact of poor health. So this is a society-wide issue. And of course, people have a choice about what they are able to buy. But this is actually about how people are confronted in areas of poor food choice, where actually some of the high streets have been turned into these areas where there's no longer a baker and a greengrocer. It is just row after row of pizza bars and burger bars and takeaways. So actually choice has been removed from consumers. And I think this is more about levelling the playing field and actually getting some decent messages out there and making it perhaps possible for healthier food choices to come through instead of that proliferation of takeaway. So my answer to nanny state is gangster grannies all round.
That's such a wonderful image. Thank you very, very much. And in terms of the sort of David and Goliath battle, in our report, we do link to some really quite shocking research about the huge efforts that the major fast food companies are going to fight any efforts that councils make to restrict the growth of fast food outlets. So do take a look at the report. One question here for you, Bev, and somebody said that she was interested in your distinction that you said the findings or the implications of your work wouldn't apply to KFCs or McDonald's, but only to sui generis uses. And could you expand briefly on that? So I guess that what you were saying was that this isn't about restricting places that are categorized as restaurants rather than hot food takeaways. Is that what you were alluding to?
Yes, you are right, Julia. Our guidance is solely on hot food takeaways that come under the sui generis category. And they are, on the top of my head, it's an establishment where you order, pay and go. There's places with no seating, so there's no waiter service. You just order your food and go. And that is a different category, say as a McDonald's, where you go in and you sit. That is under a different category, and we could not tackle that restaurant in the same way as we could tackle the sui generis hot food takeaways. So I hope that's defined it clearly enough. There is a very different definition between the two types.
Thanks, Bev. And I think what that really highlights is that the way that hot food takeaways and well, the way that planning and regulation impinges on the food environment is incredibly complicated. And I think in some respects, the way that planning, in particular, planning policy deals with the food environment is perhaps now out of date because things have changed so much in the last 20 years. And perhaps now's the time to take a fresh look at the way that planning can or should be able to control what's available and what isn't available where people live. But that's a whole other big question. I'm conscious that there is an enormous amount of interest in this topic and it is very complicated. And I'm very pleased that there are a couple of initiatives to help people tackle this. So if we could have the slides back, there are 2 slides that might be useful for people. Brilliant. So there's this toolkit for managing takeaways near schools. There's a link to it in the slide, and that's been developed by Dr. Tom Burgoyne, and well worth having a look at, full of useful information and practical guidance. And we have one more slide to share with you. Thank you. And that's a new online training course about planning for a healthier food environment. So again, it's a really complicated subject and hopefully some of you might find this of interest. So we're coming to the end of our lunchtime webinar. Thank you very much to everybody who's joined us, and particular thanks to Tim Borrett and Beverly Bayliss for their presentations. And I can see from the comments that people have found them really valuable. Please take a look at the report. Many thanks to Mo Baines and colleagues at APSE for supporting this report and enabling it to happen. We've just touched the tip of an iceberg. This is a huge, complicated and important subject, and I really hope we can return to it and do some more in-depth work because there's clearly an awful lot of interest. So thank you all very much for taking time to join this webinar. Do read the report and we hope you find it useful.
Thank you, Julia. Thank you all.